Welcome to Body in Balance Podcast. I am your host, Charlotte Johnson, the certified licensed physician assistant, sent here to kick some knowledge your way once a week for the purpose of educating, informing, and enlightening this audience concerning physical, spiritual, and emotional aspects of our bodies in relation to our Creator, the one, the only, the true and living God. He is the King of Kings and the Lord of Lords. Let us give it up for Yahweh. Hey, have we got a hot topic today? We're going to be talking about some life-saving and life-giving information. It's going to be very important because you need to pay attention. This can be a life or death situation. We're going to be talking about anaphylaxis. It is a serious matter. Again, anaphylaxis, it is a serious matter. And so we're going to be talking about the things you need to do, the things you need to watch out for. And let's get started because it's going to be a lot of information. Understanding anaphylaxis is what we're going to be talking about. And let's get started with the agenda. It is some key topics. What is anaphylaxis? What is it? I know a lot of you have heard of it, but we want to talk about exactly the definition of anaphylaxis. Recognizing anaphylaxis is important, even though you are not a physician assistant, nurse practitioner, registered nurse, MA, doctor, any kind of physician, chiropractor. You may not be any of those licensed medical providers, but you need to know this information because you've got to recognize when your child is in trouble, when your family member's in trouble, when your best friend's in trouble, when a stranger is in trouble. You got to recognize what's going on. Immediate response and treatment. What do you do when you see it? What should be happening? Wow, we got to get that under control. Preventing anaphylaxis, things you can do to stay away from having a medical emergency, and living with anaphylaxis. Okay, if you've had it once, it could happen again. If you've had it twice, you're more susceptible to having it again. So how do you live with anaphylaxis? What is anaphylaxis? Well, I'm glad you asked. Some definition and characteristics. Well, what is anaphylaxis? It is a severe allergic reaction that can be life-threatening, and it demands immediate attention. You got to know what to do immediately because anaphylaxis affects, I told you that allergic reactions can affect, it's an overreaction of your immune system. It can affect a lot of things. So it can affect multiple systems. Multiple systems are involved. You can have such systems as your skin. Well, you'll get wells and hives. That's not the worst part of it. That's an early sign. Respiratory problems, that's the issue right there. If your lips start swelling up, your tongue starts swelling up, then the back of your throat starts to swell up, which would close off your airway. If your airway starts to close up and your lungs start to swell, there's a hard way for you to exchange oxygen. That's what the biggest problem is. So you have to watch out for that. Gastrointestinal problems. You'll swell and have a lot of inflammation in the GI tract. Cardiovascular symptoms. You start to shut down because you constrict. If you constrict blood vessels, you don't get blood to areas that you need, your brain, your kidneys, your heart. If you don't get blood to those areas, that's a problem. Urgent treatment is needed. I repeat, urgent treatment is needed. Immediate medical attention is critical in managing anaphylaxis to prevent more serious health complications, i.e., death. So, what are some of the common triggers? I'm glad you asked again. You guys are so smart. That's why you're a part of Body in Balance. Common triggers and allergens, food allergies. Yes, food allergies. Food is a common, very common problem, especially with children. Peanuts, shellfish are well known for that. That's why a lot of daycares, a lot of small people where they used to do peanut butter and jelly sandwiches, that is not a thing anymore, because peanut butter and jelly sandwiches is not the jelly, but the peanuts in the peanut butter can cause a problem. If you don't know that child has anaphylaxis, that is not something you want to learn when you've got 15 or 20 kids in your daycare. Insect, like bees, wasps, spiders, those things can bite and can cause anaphylaxis. Cause the lips to swell, tongue to swell, throat to swell, nose to swell inside, and the lungs. Certain medications and also latex products, different rubber products. If you don't know you're allergic to balloons or gloves, rubber gloves, then you can have a problem. You'll have anaphylaxis. Those are things you need to be aware of and watch out for. So we talked about what is anaphylaxis, and we talked about the common triggers. Here are some key signs and symptoms. Signs and symptoms. You need to know these signs and symptoms. If you're sitting next to someone and all of a sudden they're eating something and you're at Red Lobster, say, and you're having this really nice date, and all of a sudden your date, you look at them, their eyes look like they're swollen. And you keep talking to them and they start coughing. And they continue to cough. And you look again and their lips start to swell. Hives, and then they break out with a rash. Hives and swelling are common symptoms of anaphylaxis. And they appear automatically. I don't know whether you guys have ever seen that movie, The Nutty Professor. It's hilarious, by the way. But The Nutty Professor, when certain things would happen, it was Eddie Murphy. And then he would turn into this really big, gigantic guy. But things would swell on him and pop out real quickly. He would go from having thin lips to really plump lips, and thin cheeks to having swollen cheeks. And he would turn into this obese guy. Well, what happens, those kind of things, it happens that quickly. Difficulty breathing. Someone starts coughing a lot, and they can't catch their breath. You got to start thinking possible anaphylaxis. If they were eating something, rapid heartbeat. The heart races real quick because it's trying to get blood to the vital organs, i.e. your brain, i.e. your heart and your kidneys. Those organs are trying to survive. So the heart beats faster because it has to push against constricted blood vessels. The gastrointestinal distress. So you may start getting nauseated or vomiting, or that person starts to get nauseated and vomiting. Those episodes are something to watch out for because there could be a problem. See how this child's lips have swollen and you can see the rash on his chest, that's the kind of thing that starts to happen. All of a sudden, your child had some M&Ms, and they were peanut M&Ms, and you start noticing a rash, lips swelling up. That's a reason for you to decide to go to an emergency room. Now, before you get to that emergency room, you're going to need to treat that. Before we jump too far ahead, some early warning signs is the itching, the swelling, hives, as we talked about, or they call that urticaria. Urticaria can appear as raised wells on the skin, indicating allergic response. That immune system is going crazy, and you start getting that rash. Important to be aware of this because it escalates quickly. This can happen in minutes. In seconds, you go from swollen mouth, lips, tongue, and then the airways swelling. That's why it's so important to know these symptoms. I keep stressing this. I've had 2 slides showing this. When you see something like this, it's important to do something about it. So we got to figure out differentiating from other allergic reactions. That's not really up to you. If I were you, I would go straight forward with thinking the worst and getting the best help possible. Understanding anaphylaxis is a severe, potential life-threatening allergic reaction that requires immediate attention. What does it require? Immediate attention. Do something. You've got to do something. Symptoms of anaphylaxis, I've said it again and again and again. Rapid heart rate. It comes on quickly. It's severe. It's difficult for that person to breathe. They start swelling, and you got to do something about it. Mild allergic reactions, those things, you don't see that swelling of the lips. They may be coughing. They may be short of breath. That's not as bad. But when you start seeing those lips swell and things like that, you got to do something. And that is, you got to activate right away. Again, timely recognition. This is a whole nother slide with something else, but it's talking about the signs and symptoms of anaphylaxis, early recognition, consequences of delayed treatment. You could watch somebody die right in front of you. Yes, if you feel scared straight, good, because that's what I want. Do something when you see anaphylaxis, swollen lips, rash all over, eyes swelling, coughing, feeling short of breath. It's time to activate. And what are you activating? You're going to activate the necessary things for someone to get help. All right. Yes, you want to activate. You want to get it going. You want to hurry up and get it going because they have got to get to the hospital. It's a 911 emergency. Yes, I said it. It's a 911 emergency. You better do something. You got to call 911. You're not a provider. You just know your friend. You just know your child is in trouble. You got to do something. That's right. Call 911 and get that activated. You want to start doing that so that they are safe. Now, if you already know that child of yours has a problem, that child of yours has severe allergies, then you're going to already have your mom, your dad, your sister, your brother has severe allergies. You're going to already have an EpiPen. Yes, you're going to have an EpiPen. And that EpiPen is key to your starting to do something for that person. Not only do you call 911, but you get that EpiPen out. Most of those EpiPens are auto injectors. It basically, there's one that's a auto injector that it talks you through exactly what you have to do. It tells you, take off the cap, press it on the leg, you press it on the thigh, and you push real hard. You will hear a click, and when it clicks, you let it sit there for like 3 minutes. Yeah, 3 minutes. And as that medicine gets in, they will start to notice. Now, they will start to feel jittery. They're going to feel like Barney Fife. And if those young people that don't know who Barney Fife is, you guys love to Google stuff, Google it. He was on the Andy Griffin show. But the correct dose already comes out of that medicine. So you don't have to worry about trying to draw up any medicine or anything like that. You're just getting that EpiPen put into the body by taking the cap off, pressing it up against the thigh, holding it for 3 minutes, and then let it go, and the medicine will go in. By then, the ambulance should be on the way. That's what I mean by activate. The emergency response system is going to come and they will take over. You call 911. Okay, for those of you that don't have the number to the emergency, 911. All righty. Call 911, get that started. Get that EpiPen, administer the EpiPen. The person is going to say they feel like their heart's racing. They're going to feel jittery. It's okay. You would rather have that going than not, because what epinephrine does is it slows down all that swelling. So they will start to breathe better. Their lips will start to decrease. The swelling in the lips will start to decrease. Now, when they start getting better, that doesn't mean go ahead and take them home. That doesn't mean let them go. You got to send them to the emergency room. Well, why is that, Miss Johnson? They're better. I got them all healed up. No, you didn't. You got to send them to the emergency room because that epinephrine stays there for a short period of time. 30 minutes or so, this whole reaction can start back again. And if you don't have another EpiPen, you're going to be in trouble. So they need to be monitored by an emergency room and an emergency facility. All right? Don't take that on yourself. Aftercare. So what should be done for the aftercare? To prevent anaphylaxis, there's some things that need to be done. One, avoid known issues. Avoidance is the number one key to making sure that you don't have problems. If you can't eat fish, if you can't eat shrimp, I would suggest you don't go to a hibachi restaurant, because even though you tell the people there are 12 other people sitting around that table, they may try to keep things away from there. But even if, depends on how serious your allergic reaction is, even if they use the same spatula to turn the shrimp over with, and they move and they use it to turn your chicken over with, you're going to have problems. If you accidentally get a piece of the thing that you're allergic to on your plate, some people are so highly allergic that it can be a problem for them. I remember there was a 12-year-old boy, and this is not a good story at all, but the 12-year-old boy went over to his grandmother's house with his father, and she was preparing a cookover of a seafood boil, and she was making fish. Well, the young boy was allergic to fish. And when he stepped in his grandmother's home, as soon as he opened the door, stepped in his grandmother's home, she's frying that fresh fish and it smelled so good, but the smell affected him. And he sniffed it as he could, because he could smell. And then all of a sudden, he started having an allergic reaction. They called 911. He did not have his EpiPen. That poor 12-year-old boy died at his grandmother's house just from being in the house around the smell of fish. So you don't know how badly your allergies can be to it. That's why you want to get tested if you're allergic. Once that happens, and once they find out, those things avoid. Again, I usually tell my patients, if you're allergic to seafood and things like that, don't eat at hibachi restaurants. You need to let restaurants know. In fact, a lot of times it's better to cook at home if you have severe allergies. So identify your allergens. Keep a list of your allergens. You may want to put them on a 3x5 card. Keep them in your purse, keep them in your wallet, keep them in your back pocket so that you can know. You ever fall out at Walmart, then somebody would know. And emergency bracelet is good if you have severe allergies. Planning ahead. Plan ahead for your daily activities. Make sure you plan your meals. Watch out. Make sure that you let the daycare know your child cannot have peanuts, because some little 5-year-old's not going to know any better and sneaks in some peanut M&Ms, and just because they want to share and be nice and give it to your child, that's a problem. So, effective communication with your friends. Let them know that you're allergic to this, that, and the other. Watch out for restaurants. Make sure that you let them know and tell them. Now, a person that has peanut allergies, I'm going to just throw this out there. Popeyes cooks in peanut oil. So if you go and you eat their chicken, you can eat Kentucky Fried Chicken all the time, but you just decide you want to eat Popeyes chicken and you didn't know that there was a peanut allergy. It's posted in the restaurant, but you need to know. Now I'm telling you on the World Wide Web. All right, so make sure that you communicate properly with people to let them know about your allergies. Create an action plan. What is your action plan for your family? Creating an action plan is important. Establish the action plan of what you're going to do. The first thing you should do, what's the first thing you should do? What did I say was the first thing you should do? Wow, you better be calling 911. You better get that ambulance a-rolling. Just like I said, you gotta make it. Call 911. Call them. Get that ambulance rolling. It's important that you do that because you have somebody's life on the line. Could be your family member, could be your friend, could be your coworker, could be your boyfriend, your girlfriend, your husband, your wife. But you got to get that ambulance going. That's important. Then, if they need an EpiPen, make sure that they have their EpiPen with them. You may want to have two. Usually there's a buddy pack. It comes in two. You might want to keep one in the car, one in your purse, one with you somewhere that you go. If you're going to go out to a restaurant and you are highly allergic to a lot of stuff, make sure you have that EpiPen with you. Sharing with others. Once the action plan is created, let other people know. It's no secret. Let people know at the family reunion so somebody doesn't put raisins in the potato salad. You don't want to do that if the person is allergic to raisins, okay? If a person is allergic to fish, then not fish, but if they're allergic to peanuts, you got to let them know if they're coming over for Thanksgiving. Are you frying the turkey? Most of the time, people fry the turkey in peanut oil. Okay. So you would bake their turkey or have ham or do something else and let them know you cook the turkey in peanut oil. So educate your family, let them know that they need to, if there is anaphylaxis, somebody in the family has a problem with anaphylaxis or has had it. Usually if you have it once, it's not going to happen again if you do proper avoidance. However, if you don't do proper avoidance and something comes up accidentally, be prepared. Let that action plan kick in. Emergency response training. Show your loved ones. If somebody has an allergic reaction, it would probably behoove you to know CPR, to have someone in the family that knows CPR or to learn it. You can go to classes in the community to learn that. And then to reduce the anxiety, proper education for everyone, all of your loved ones, for what to do in an emergency situation. Get that ambulance rolling, get that EpiPen out, and I would suggest that you don't take them running off to the hospital. I would call 911 to get them to take them because they can give them oxygen on the way. They can give them the needed medications on the way. They can hook up IV fluids because you want to make sure that fluids are getting in because of the kidney effect and what could happen to the kidneys. If you live with anaphylaxis, these things you need to know, these things you need to keep up with. Meal planning is important. Avoiding certain things, medical identification and communication. You want to get a medical bracelet. Like I said before, those things are helpful and you want to communicate properly. So in conclusion, importance of understanding anaphylaxis. You got to understand what's going on with somebody. When they start swelling up, I know it may look funny, but it's not funny. It's serious. And so to manage it, prevent it from getting, it is a severe allergic reaction that's occurring. This is a life-threatening reaction. Just getting hives and scratching, that's not anaphylaxis. But when the lips start swelling up, tongue starts swelling up, throat and nose is swelling up, that's a problem. Recognizing these symptoms of anaphylaxis allows for timely intervention so that you can save the life, and proactive management. Ambulance, ambulance, ambulance. Call, let me give you the number again, 911. Call that number and make sure if they have an EpiPen, you give them an EpiPen. Giving them an antihistamine like Benadryl, that can help, but that's not going to stop anaphylaxis. That is not the number one treatment. The number one treatment for anaphylaxis is number one, call the ambulance. And then if you're with them, give them an EpiPen. That is the medicine that they need. I can't stress that enough, but I've spent a great deal of time sharing this with you. Hopefully you get it. You get the understanding of calling 911. Next week, I'm excited that next week we're going to be having episode number 8, and we're going to talk about I can't breathe. The importance of upper and lower airway when allergies kick in. How allergies can affect the lungs. So the upper airway or the unified airway is from the nose to the lungs. And that's what we're going to be talking about next week. I look forward to seeing you there on Body in Balance. Hopefully, your horizons have been enlightening.